What to expect from a fibroid surgery? If you want to keep your uterus and ability to become pregnant, you may choose to undergo myomectomy rather than hysterectomy. Myomectomy is a type of surgery used to remove uterine fibroids. In this procedure, only fibroids are removed, not the uterus. Why do we remove fibroids? We definitely need to remove fibroids if they give you symptoms like pelvic pain, heavy periods, irregular bleeding, urinary frequency, and probably causing infertility. A myomectomy can be done in one or three ways. It can be done abdominally or through laparotomy, then it's called abdominal myomectomy. It can be done laparoscopically, it's called laparoscopical myomectomy, or it can be done through a hysteroscope and it's called hysteroscopically or hysteroscopic myomectomy. What is the good candidate for myomectomy? Myomectomy is an option for women with fibroid who wish to get pregnant in the future. Therefore, it's basically a conservative surgery in which fibroids are removed so that that particular woman can become pregnant in the future. Unlike hysterectomy, where it takes out the entire uterus, and that particular person cannot be able to be pregnant in the future. How to prepare for surgery? Usually we'll take the blood because we talked of that you may lose a lot of blood due to fibroids. Then we'll take bloods and test full blood count, UNE, and so forth. We may do MRI scan. We may do a pelvic ultrasound or even a Doppler study, just that to be sure and prepare yourself for surgery. Abdominal myomectomy is usually a horizontal incision of about 6 to 10 centimeter, or it can be done through a vertical incision below a belly button incision. It can be done as well myomectomy laparoscopically, which is called laparoscopic myomectomy, which abdominal incision, which may be 3 or 4, depending on the surgeon experience, which are about 2 to 1 centimeter in the abdomen. And hysteroscopy is done through a resectoscope, in which a scope is put to look at myoma and then resect off the myoma. What is expected, or how long do I recover after the procedure? If you do abdominal or laparotomy, you're expected to recover within 4 and 6 weeks. Laparoscopically is very short. Within 2 to 4 weeks, you should be ready and be able to go back to work. Hysteroscopy is even shorter, 2 to 3 weeks. What are the complications which I may experience or the risk which are associated with any procedure? Any operational procedure is got risk. Any procedure which is operation is got risk. Now, the risk when you do myomectomy may be the following: infection in the wound or even abdominal inside, excessive bleeding, damage to nearby organ, uterine perforation, scar to the uterus itself and the fallopian tubes or damage to them too. New fibroid may also grow up after the procedure, and you may end up with hysterectomy, although the chances are rare. If you have done an operation, myomectomy, or even hysterectomy, please call your doctor or try to contact your doctor immediately when you see the following: heavy bleeding, fever, severe pain, trouble in breathing, breathlessness, abdominal distension, excessive vomiting. Those are important signs you should remember. How will myomectomy affect future pregnancy? Women who have more than 6 fibroids removed, large one, most of the time they will have difficulty in getting pregnancy. The fibroid may even distort the inside of the uterus, and that particular person may have difficulty in getting pregnant naturally or even with IVF. Therefore, in that case, you may have to do what is called surrogate because your uterus may not be able to carry the baby. But if conservative surgery is done with the main intention so that we can keep your uterus and you can then be pregnant on your own, most likely laparoscopic surgery, which is myomectomy, give better result in that regard. Thank you.